starting that now. Okay. Welcome to the joint meeting of the Maryland Heights and Creve Coeur Township Democratic Clubs. And before I do introductions, I'd like to start with the Pledge of Allegiance. So if you would join me, as soon as I can get the right screen up here. There we go. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Hopefully a Supreme Court that appreciates that. Okay. I'd like to introduce the president of the Creve Coeur Township Club, and that's Sydney Jackson. I want to just say hi for a moment.
Hello, everyone. Thank you for joining us this evening.
And also my assistant in running these meetings, Alan Harris-Dalt, and he'll be watching YouTube for questions and also helping me out here as we expect a lot of people to be on, and they're still coming on. Okay, with that, I'd like any elected officials to take a moment and introduce themselves. I know we have a number of folks here, so first come, first served. Just jump right in, and you would let us know who you are.
No, we're Dave and Dale Steinberg. We're the committee people from Maryland Heights Township.
Thank
Kathy
you.
Kathy Paulsmeyer, committee woman from Chesterfield.
Welcome.
Good evening, everyone. Nicole Greer, councilwoman from the city of Creve Coeur.
Welcome.
Trish Gunby. Oh,
Nope,
Trish
there you
Gunby.
are.
I'm a state rep in the 99th district.
We will get to candidates also in a moment. Tracy?
Hi, Tracy McCreary, state rep in the current District 88.
Okay. Is there anyone else who's elected representative or representing an elected representative? Okay, hearing no one at this time, let's move on to candidates. So if you are a candidate for office, if you would take a moment and introduce yourself. I see a couple of folks out there. I think I will ask Trish Gunby to kind of kick that off. And also, Trish, if you would take a moment and maybe comment on the federal congressional House maps that we finally have for the state of Missouri, I think, if the governor signs.
That sounds about right. Hi, everybody. Happy to be here tonight. Trish Gunby. I'm a Democratic candidate for Congress going up against the absent and extremist Ann Wagner. So we have been, I announced back in August, and I've been working as a state rep and simultaneously running a campaign, as some others on this Zoom have been doing. And I will tell you that it was good to get a map finally. As a candidate, obviously that's the first thing you think you should get and you should have. But I know Tracy's map came a little bit late too for her state Senate race. And part of that is just the dysfunction of the Missouri General Assembly. And they were, it was on full display. And even if you're a supermajority, difficult to get your act together. But that being said, we have a map right now that takes in no Jefferson County, obviously lines drawn differently between the first and the second, but it pushes us westward to Franklin and Warren counties. And so that's where we will go. Everybody keeps asking me, what are you going to do? What are you going to do? Same thing I would have done wherever the map was drawn. The playbook stays the same way I got elected last 2 times is you talk to voters and you work your tail off. That's pretty much the formula. And so if they're going to send us out to Warrenton or wherever, we will go there. But excited to meet folks out there. As I've told people, we have not seen Ann in St. Louis County. So chances are you will never see her in Franklin or Warren County. And that will be the message, is just that she is absent, not accountable, period. Whatever you believe in terms of policy, when you don't have your congressperson present or visible, that's just downright wrong. No town halls, all of that. So what I would just invite people to do is to find out more about me and my race. Go to my website. I'll put it in the chat. We are in the midst of door knocking. We've been doing that since August. Phone banking. We've hit upwards of 12,000 households. We've been through Manchester, Baldwin, part of Chesterfield, Town and Country. We're now in Kirkwood. And we were doing that because we didn't know the map, but we knew those areas would be in the second. And so now that we know that, we are looking at precinct data and deciding kind of what our next path will be. But we just need people to door knock, people to phone bank, host events, and we need money. And so when everybody asks about how are you going to go up against Ann, she spent upwards of $12 million in the race against Jill Shoup. So you can do the math, and I need a lot of money. So, but besides that, we just need feet, good tennis shoes, and tires. That's what I'm telling everybody. Tennis shoes and tires.
Thank you. Any questions for Trish? Question of how do you get a yard sign?
Those are coming, and probably closer to the primary. I know a lot of communities. I have one volunteer who loved going through all the municipal zoning information or codes and telling me about signs. So that's something that's coming along. It's interesting. As you go farther west, there's some different codes out that way, but we will make those available. We'll let you know. Just follow me on social media. If you do want to get in our database in terms of wanting one, I'll go ahead and here we go. Let me put up my, I'll put my website in the chat, and you can go on and under volunteer, you can just indicate that you want a yard sign, and we'll get that in the database.
Very good. Thank you. Tracy, would you like to say a few words?
Thank you. I'm running for the Missouri State Senate in District 24. It is the seat being vacated by Senator Shoup. Unfortunately, due to term limits, she cannot run again. The district is different than it has been for the last 30 or so years. It starts up in Maryland Heights and wraps around 270 down to Sunset Hills, Fenton Valley Park. So it's just a big swath kind of all along 270 from Northwest County down to South County. So it's definitely winnable, but as all of you know, midterm races, these mid-session races can be tough on Democrats. So we're going to need everybody's help. So we will probably have another meeting about that, is my hunch. I'm sure Harvey and Sydney are already aware of that. Thank you.
Very good, thank you. We have other candidates and representative of candidates. First come, first serve. Who wants to jump in and say a few words?
Go ahead, Jacob.
If people aren't jumping up, I would like to suggest it would be good that if somehow everyone who is running somehow get up tonight, your name and your website, if you have one, because there may be people here who would like to make contributions to you or may want to have that. And it's nice to make nice saying words, but it's also important to give out the information that will be helpful to you.
Thank you. Jacob.
Yeah. Oh, sorry, sir. Oh, okay. I'll go ahead. I am a representative for the Lucas Coons campaign for U.S. Senate. I just wanted to be here and attend the meeting and kind of introduce myself to y'all. And I can be a point of contact for the campaign that anybody wants to get in touch. Do you want me to talk about the state of the race or anything, or talk about Lucas himself? I'd be happy to.
I would think Lucas himself is probably good. You have 2 to 3 minutes.
Yeah, just basically, Lucas grew up poor in one of the poorest neighborhoods in Jefferson City. He's a homegrown Missouri boy. And after his little sister was born with a heart condition, his family went bankrupt. And as he grew up, he got to watch his community and his family take care of each other. And they all rallied together and helped put him through college. And so after college, he went to the Marines. He enlisted and spent 13 years as a Marine serving his country. And in between tours of duty, he would come back and watch the neighborhood that took care of him, the people that took care of him, get basically destroyed, devastated by the effects of the policy decisions of our leadership in this country. The childhood home he was born in is now a vacant lot. The home he left for college from is boarded up and covered in graffiti. And so what he saw is that our country prioritized several pointless wars, spent $6.4 trillion on wars abroad, and didn't bother investing in its own communities. So that's why he's running. He is here to serve his community and pay back the service that they did with him. And he wants to rebuild our communities and invest in our neighborhoods and our people and our infrastructure. So I wanted to talk a little bit about how the race has kind of gone. He's raised $3.5 million, and that is without being, without taking any money from fossil fuel corporations, from lobbyists, from big pharma, from big ag, from any of these corrupt corporations or corporate PACs. So that means we can be beholden to voters rather than corporate interests. So that's why he's running. We've done this the right way. We've got an average donation of $35, so $3.5 million with an average donation size that is that low. It's a powerhouse fundraising machine. He's been working his butt off getting all over Missouri, which, by the way, is why he couldn't make it here tonight, so I apologize. But he's also built a team. I think we're up at 15 people strong now. That we can start being at all places at all times. We've been all over the place, and we've been in St. Louis several times in the past 2 weeks. We did some town halls. We were at Annie Malone and Valley Flowers and Florissant. So we're all over the place. We're working hard, and I am really here just to meet you. And I'd love to take questions and answer questions as needed, but I don't want to take up too much of the time. So I'm going to put my email in the chat, and I'm going to put Lucas's website. You can sign up to volunteer. We'd love to have you. We've got regional organizing director that just got hired in St. Louis, so he'll be handling a lot of the volunteer contacts. Any donations, obviously. This is a grassroots campaign. We really need your support, and we cannot win statewide without the support of everyone. This is going to be an uphill battle, but I think we're the best chance at beating Eric Greitens, who is our likely opponent in the general. So I would really appreciate it. I'll put everything in the chat. If anybody has any quick questions, I can take them, but Harvey, I'll leave that to you.
Excellent. Thank you. Who else do we have online?
Harvey, I'd love to go.
By all means.
Hi, everyone. I'm Melissa Greenstein. I am your Democratic candidate for Missouri's House State District 101. For those of you who aren't familiar with the new House maps, the little House maps, not Trish's House map, the little House maps, 101 now encompasses the Chesterfield Valley area as far north as the river. It comes across and down most of the neighborhoods south of that, kind of along the Wild Horse Creek Road, all the way east, including the Chesterfield Mall, but somehow not Yaya's. And then it goes a little bit further east along like Clarkston and 141, almost to Parkway Central, not quite including the hospital, but it's gerrymandered, so it's a little wonky over there. Like I said, I'm the only Democrat, I'm the only woman, so I am the progressive candidate in this race. There are 2 Republicans and a Libertarian, all men. So they obviously have some battling to do in August. But I'm going to need help because one of the candidates in particular is his father has self-funded himself several times with millions of dollars, like Trish was saying about Anne. So there's a monetary component there, as well as just getting out and knocking on those doors and making those calls. So I'm also going to drop my website and information in the chat. You can sign up to volunteer with me. You can sign up to donate. You can reach out. We're going to be having a canvassing kickoff in June, a big campaign kickoff in June. So I would love everybody's help. The more the merrier. Thank you.
You're still muted, Harvey.
Thanks, Sydney. Any other candidates that we haven't recognized, or candidate representatives? Okay. I will take a moment and share a document here. I captured the names of the folks who just spoke. I think I have everyone. If I don't, someone correct me. I do want to point out the spelling of Lucas's name. It's a little unusual. So I have highlighted that. So if you Google any of these folks, you will find all kinds of good information about them, including their campaign sites.
Real quick, Harvey, that's Lucas. It should be Lucas.
Ah, okay.
Sorry about that. Thank you.
What? Through the magic of computers, I just fixed it. Okay. Okay, and I'll also put this in the chat in a moment once we get the rest of the meeting going. Okay. We also have an announcement. I'd like to ask Ed Weisbart, or whatever the situation is. He's one of our local folks who's a national warrior for a sane and rational healthcare system, national healthcare system. And while we happen to have him, I'm going to give him the floor for a couple of minutes.
Thanks so much, Harvey. You're the real warrior. So I spend most of my time advocating for Medicare for All through an organization called Physicians for a National Health Program. I'm a family physician. That seems really important to me. But no matter what you might think about Medicare for All, I think everybody in the country just about agrees that Medicare itself is incredibly important and must be protected. And what I wanted to bring up is that there's a really unrecognized attack happening to traditional good old-fashioned Medicare right now that's on track to turn all of traditional Medicare over to Wall Street by the year 2030. They're introducing Wall Street investors into Medicare, and it's already afoot, and they plan to turn it over to Wall Street by the year and completely by the year 2030. And we're doing a webinar on this topic on Monday, May 23rd, a week from today at noon. And on our webinar, we're going to have Representative Ajayapal and Katie Porter, Representative Katie Porter, and a number of other good speakers. A 40-minute session starting at noon on Monday, May 23rd. You can find out more information by going to protectmedicare.net, because that's what we need to do. Protectmedicare.net, and I'll put it in the chat. So hope to see you all there. Sign up for it and learn more. Protectmedicare.net for Monday, May 23rd.
Excellent. Thank you. Okay. So with that, we will move on to our speaker, our program for the evening. A moment. Okay, we have two speakers tonight talking about reproductive health care in Missouri in light of the recent rumored SCOTUS decision. Welcome to Missouri. I think you're going to hear some disturbing things and hopefully some ideas on what we can do to make things better. We have two speakers, Maivi, and please, I'm sorry if I just messed up your name. Maeve Mead, and Representative Tracy McCurry. Maeve is Director of Legislative Affairs, Associates of Planned Parenthood of the St. Louis region and Southwest Missouri. Tracy McCurry, candidate for State Senate, current representative, a former Promo PAC member, is a founding member of the Consumers Council of Missouri, board member of Family Care Health Centers, and former board chair of Safe Connections. So with that, I would like to turn the floor over to the two of you and kind of let you just figure out who wants to speak first, and hopefully educate us and let us know what we can do to help.
Well, thank you to both of the clubs for having us this evening. I have worked with Maeve Mead in many different capacities since the early to mid 1990s. So it's an honor to be on a panel with Maeve. We just finished our legislative session on Friday. We finished a couple hours early. We had to be done by Friday night at 6, and I think we were done by 4-ish on Friday. And considering that we are Democratic clubs, it's a good thing when the legislature is not in session, because that generally means that they are not passing things that are harmful to the state. So throughout these entire 5 months in Jefferson City, folks from Planned Parenthood and other pro-choice groups were in the building, constantly working to fend off attacks on our sexual and reproductive health. Maeve shared with me earlier that they were tracking about 50 anti-reproductive health and anti-sexual health bills, and as well as the budget bills that are used often to harm people and limit their reproductive choices. So there was some really good news for pro-choice folks, and actually for all Missourians, there was really good news. Over 90% of the harmful bills passed. So really the 3 bills that passed this session that were most harmful to Planned Parenthood patients were things that were within the budget bills. And some of you might be wondering, well, how does that doesn't make any sense. How can we have things that are harmful to reproductive health in budget bills? And you would be correct if you were asking yourself that, because it doesn't make a lot of sense. So the governor signed a supplemental budget bill earlier this year where they attempted to defund Planned Parenthood by blocking patients who rely on Medicaid from being able to get care at the provider of their choice. And a lot of people, some with insurance, some without insurance, choose to access health care at Planned Parenthood. And so through that supplemental budget, as well as 2 budget bills, House Bills 10 and 11, the state is doing something that I don't think is legal, but they are trying, some in the Missouri legislature are trying to do that anyway. So, and the reason I'm not sure that it's legal is because right now federal Medicaid law protects every Medicaid patient's right to choose their provider, and that includes Planned Parenthood. So, I am hopeful that the Biden administration will intervene in what Missouri is trying to do and uphold a patient's right to choose their provider. So, but all in all, we had a really successful session as it relates to stopping things that are anti-reproductive health and anti-sexual health. One bill that affects all of us that did pass, and although not directly related to reproductive rights, I truly believe that anything that impedes people's ability to vote and participate in democracy is bad for all of us. There was a bad bill that passed, I think it passed the House on Thursday, that some of us call the voter ID bill, but it had a lot of components to it. So now the bill did start out early in session. It was a House bill. It started out early in session, much, much worse than it was when it finally passed at the end of last week. But right now the bill would require voters to present a government issued photo ID. There's also a lot of other things in there, such as prohibiting touchscreen voting machines, requiring different cybersecurity checks and that kind of thing. You know, as most of us on this call are fortunate to be in St. Louis County, where we have an amazing board of elections that's run in a bipartisan manner, but it's run in a very, very tight way. My concern about this bill that passed is a lot of the things that were put in the bill came out of these really bizarre hearings that included the person that is the founder of that pillow company coming to testify and that kind of thing. So, you know, I think there was a lot of, you know, we've never had any evidence of widespread voter fraud or irregularities, but yet this bill was crafted around these things that are not proven to be true. So, but of that wide-ranging voting bill, the most concerning part is the photo ID. So we will just have to see what the courts decide to do with that. But we all should be concerned anytime the state tries to do something that could help, that would squash down voter participation. Other than that, I think I'm going to turn it over to Mevi. She is the true expert on what's going on with the state of reproductive health care in the state of the nation. Many of us legislators were in shock really the morning after we saw each other for the first time after that Supreme Court document leaked, because we just felt so helpless and confused and not sure what to do. So I'm really looking forward to turning this over to Mevi so we can learn more. Thank you.
Thank you, Tracy. Let me just check that my speakers are working and people can hear me. Can I see any thumbs up? Oh, thank you. Okay, great. So, oh my gosh, what a great club you all have. What so many experts and so much expertise I'm seeing on this Zoom. Thank you, candidates, for engaging in, you know, public service. Harvey, Sydney, thank you for inviting me. I'm honored to be here. And, you know, I don't get to take a point of personal privilege like Tracy or elected officials get to take. So I'm just going to go for it right here, and you can mute me if you don't want to hear it. But Tracy and I have worked together for, or don't kill me, over 20 years, Tracy. Before I was at Planned Parenthood, I've been there. I'm sorry, I should say my name is Mevi. I work for advocates of Planned Parenthood, the St. Louis region and Southwest Missouri. So a healthcare provider providing services to over 40,000 people in that St. Louis region and Southwest Missouri area. And that also includes 7 counties in Illinois. So that's what I'm advocating for, the ability to provide the full range of reproductive services to thousands and thousands of those folks, many of whom are under the federal poverty level, and people who, you know, thank goodness for Dr. Weisbart and I'm sure other people on this call wouldn't be able to access their health care without Planned Parenthood. We are an excellent, outstanding, keep ourselves totally up to date on all the sexual and reproductive health services in the field that is changing. The number of reproductive health, particularly birth control, contraceptive, sexually transmitted disease options that patients have is changing, evolving. You know, the entity I work for is direct line researching to improve all of that. And I think you all know St. Louis is a hotspot we have one of the highest sexually transmitted disease and infection rates in the country. And so that's the group I get to work for that are fighting for that. So, but before I did that, I worked for NARAL, and I have to tell you, Representative, soon to be, I hope, Senator McCreary was possibly one of the best board members ever when I worked at what was called NARAL, currently called Pro-Choice Missouri. It is an advocacy organization that doesn't provide services, but does tons of great things. I can tell you about that later. But Tracy was our PAC chair, and she ran all the, collection of surveys and evaluation of candidates. And the minute we had a chance to hire a new organizer slash pack manager, that was Tracy. And so she and I got to work together in the 90s, and she is the best board member, staff person, advocate, tax paperwork filer. I mean, just Tracy is amazing. And we are so lucky to have her as a public servant in this state. I have been so impressed to see Tracy's ability to go to the Missouri legislature and realize that a place that Democrats really needed to focus on related to agriculture and do so in as much of a bipartisan way and sort of plug a gap with urban or suburban Democrats not necessarily connecting with this big part of our state that's rural agriculture. Tracy saw that, has gone in and become an expert in that, and then has the potential to bring that credibility to the Senate, which just is amazing. And I'm so lucky to get to have this long-standing relationship with Tracy, and I couldn't not use this moment to thank you. And I think the rest of this group really thanks you. Show her some love in the chat or with your emojis. Please do. Okay. So, what the heck is going on as it relates to reproductive rights in Missouri? I work for a reproductive rights healthcare provider. I run the advocacy program for this reproductive health provider, and I have so many emotions, and I'm sure everybody on this call does, related to what we learned from the leaked Supreme Court opinion that basically says the fundamental right to privacy that includes access to people's access in this country to reproductive health services, abortion, contraception, marriage, any number of things is about to be overturned. That is what is happening. I had all the emotions, but surprise was not one of them, because in Missouri, we have seen that this supposed right via Roe v. Wade was really not even the floor, it was like the subfloor in Missouri, because the state legislatures and the Supreme Court have been allowing such an erosion. And so I come to you tonight to say, I think it's a very good thing that the Supreme Court is going to tell it like it is, which is this right doesn't really exist in the United States right now for everybody at all. And so, yes, there are far-right, politically motivated conservative folks appointed by Trump, and there's all the politics associated with that. But the bottom line is they're just going to tell it like it is. That right is gone. And for us in Missouri, and for people who are marginalized, people who are Black, people who are brown, people who are low income, LGBTQ people, people who have different insured status, people who have different gender identities, that right's been gone for a long time. And so a thing I will say is that as upsetting and appalling and bold as that awful leaked decision is, there are a lot of people in our communities who are like, so what? Like, that's my day-to-day reality. So all of us have to balance how we engage in this, what's next, and I'll talk a little bit more about that, with the knowledge that there's a whole lot of people who are feeling like, whoa, this right is being taken away, but there's a whole lot of people for whom this right has already been taken away. And so my hope to you tonight is to say, we are now looking in the face of an opportunity to recognize that and to build a right. I almost said rebuild, but we're not rebuilding. We're building a right that is durable, that is equitable, that provides people the care that they need, and is fully about all the things that can happen to you related to reproductive health care, prevention, birth, decisions not to give birth, decisions to give birth. Our country, I think we all know, and especially Missouri, our state, are not performing in any way, shape, or form at the way a country of our gross domestic product, our situation in the world, the amount of resources in our economy should be, and that the people who live in this place with all of those benefits, economic benefits, deserve to be. And I get that there's lots of issues where that's not true. That's not true in terms of college. That's not true of early education. That's not true of elementary education. That's not going right in terms of education. So we have an opportunity to look at all of these things and talk to the public now that we have their very interested attention, and evidenced by, I'll let you know that just this past weekend, there were events on Saturday across the country, but in Missouri across, I think it was 7 communities. I know for a fact in St. Louis, we were over 700 people gathering in Springfield, Missouri. It's the buckle of the Bible Belt, people, and they were out there with Minority Leader Crystal Quay leading them, talking about this issue in St. Louis. Don't read the headlines, baloney. We have on record over 1,000, nearly 1,500 people who signed in, and we did not have enough people to sign everybody in. So we had over 2,000 people in St. Louis coming out to say, wait a second, we want to engage. And now it is our opportunity, our responsibility, and I call on all of you to help us build a durable, equitable, accessible right. Our national president, Alexis McGill Johnson, you can Google her. She's an amazing activist and leader of National Planned Parenthood, was recently in St. Louis in April, speaking at an annual fundraising luncheon. And I was really inspired to hear her say, you know, civil rights has a cadence and there are ups and downs. And if you look at those as defeats, then you were defeated. But if you look at them as opportunities, you are at a place where you can build something more, like I said, durable, more accessible, and more equitable. And that is what I feel called to do. And again, while I have lots of emotions about what, you know, Justice Alito and Thomas are narrated in this terrible opinion that is throwing us, people who can give birth, out of the Constitution, I'm sort of glad, like, they're throwing us the whole way out of the Constitution. So it's clear to us that we're going to have to fight to get ourselves back into the Constitution, and not just white people, not just wealthy people. All the people need to get back into the Constitution, and that's going to take all of us stepping up to do that. I'm going to close here, but no, I'm glad to answer any questions more technical about what happened in the Missouri legislative session, more technical about what comes next. But that's what I wanted to share with you all, and appreciate your feedback tonight. Thank you.
Thank you. That's actually inspiring, and I hadn't thought about that there are folks who already don't have the right. Do you want to elaborate just briefly on that?
Yeah, for sure. Yeah, so in Missouri in 2019, the Missouri Health Department, so not even the Missouri legislature, People remember, they called him period tracking Randy, the head of the health department, just basically reinterpreted all of the existing rules in the Missouri Code to mean that you couldn't perform abortions if you were a trainee under supervision from a licensed physician. Well, the trainees are also licensed physicians. That for medication abortion, which is a pill regimen, and the best medical practice is that you do an examination that is not invasive or vaginal. That in Missouri, if you want some pills, you're gonna have to undress and have a doc stick their hand up your vulva. And so no docs in Missouri are willing to do that. And that you had to meet exactly with the physician who was going to do the abortion 72 hours prior to getting an abortion. And all of that interpretation of Missouri law, which was, outrageously overreach of interpretation, but was allowed to stand, meant that Missourians went from roughly getting 5,000 to 6,000 abortions in Missouri to less than 100 in a year. So in Missouri right now, practically, there is very little access to abortion. But what I'll say about that is that the people who are still getting their abortion, going through all of those crazy hoops, are really not able to go to Illinois. They're not able to go to Kansas. They're not able. They're going to be forced into pregnancy and forced into birth the minute the Supreme Court law or Supreme Court ruling in, we think, late June or early July goes into effect. Harvey, does that answer what you were asking about?
Yes, absolutely. So at this time, I'd like to open up the floor for questions. Just raise your hand or speak up.
I have a question for Mevi. So you alluded to some actions that the health director took, but the Missouri legislature passed House Bill 126 a few years back in anticipation of the day that the courts would strike down Roe. So can you talk through what could happen practically the same day that the decision comes out?
Thanks, Tracy. So it's a little bit complicated. Bear with me, because Planned Parenthood, we're the medically and factually accurate people, so we always give that, which isn't always fit on a bumper sticker. But technically, a Supreme Court decision doesn't go into effect until 25 days after it's issued. So technically, and that is to give anybody who's impacted by it a minute to prepare. But Attorney General Schmidt has already said, and we know he likes to sue people doing anything he doesn't like or that whatever, to intimidate, has said immediately upon the issuing, he is gonna say abortions are illegal in Missouri. The bill that you're referencing allowed for essentially 3 different ways to trigger an all-out abortion ban in Missouri. So one is this Attorney General opinion that Schmidt has already said he'll offer. One is an order from the governor that I would anticipate, they're just gonna have imagine some sort of crazy dust up race amongst these people to ban abortion. So the governor will be in there, and then the legislature can also advance the ban through a resolution. They filed the resolution in the Senate in the last week of legislative session, and because of the dysfunction of the Senate, they were not able to make that happen. But special session, I don't know, there are all sorts of things that could happen. They don't have to do that. The governor can just do it, or the AG can just do it. And so we are prepared as people who care about the protection of the provider, so that if anybody, Missouri's law is a criminal penalty for those who are providing the abortion. So we're really talking about healthcare providers here. So those healthcare providers, I would imagine, the minute the Supreme Court case is issued, are gonna be worried about their licenses, and we already actually frankly have a plan to move patients based on Supreme Court rulings that we'll be monitoring on Mondays and Thursdays throughout June over to another state. So that, I think practically abortion will be banned in Missouri unless, and this is an awful thing I'm about to talk about, unless it's medically necessary. And the standard for medically necessary has to do with serious impairment of a major bodily function. Like, I mean, it sounds sort of medical, but it puts doctors in a really terrible position. So say somebody's carrying a pregnancy, it's intended, it's wanted, they're going all the way through pregnancy, and then something goes wrong. And then all of a sudden the pregnancy, not all of a sudden, or it's clear that the pregnancy is risking the woman's health. The docs are going to be in this terrible position of having to decide and potentially defend their license and a felony charge if they help that person in Missouri get an abortion in Missouri to save their health. They're gonna have to defend that in a way that we've not had to defend that in the past. So we're entering into really terrible healthcare territory, and I really don't know what to predict there, but I think mostly those people are we'll build systems to get them quickly to another state. Unfortunately, in this section of our state, it's pretty easy to get them over to Illinois, but in other areas of the country, like that medical emergency, when do you call it? Like, how long does it take a South Texas patient to get to a state where, they're going to be okay and our people are going to die on the way? I don't know. Anyway, that's sorry.
Maeve, in a situation like that, if the physician makes a referral to an out-of-state physician, sends medical records or something, are they criminally liable at that point for assisting?
No. Thank you, Harvey. That's an excellent question. So the Texas law makes people who help people get an abortion in another state civilly liable. And there's still some litigation going on about that. And there's lots of people thinking about what is it going to take to be able to withstand that civil liability. It's an expensive proposition. And so in Texas, that was what happened. In Missouri, there is no civil liability. That didn't pass this session. We were able to defeat it. There's a whole lot of politics that I think Tracy probably understands even better than I about the sponsor of that cross state line abortion ban, Mary Elizabeth Coleman nonsense. But in Missouri, that's not the case, but that is what we'll be worried about going forward. It is the intent of the Missouri legislature to export their laws to people seeking abortion in another state, and we are actively working with legislators, the governor and the attorney general in Illinois to protect people who are in Illinois who help people.
Okay, I think we have a question from Dave and Dale Steinberg.
Before we go to Dave and Dale, Lois had a question.
Lois, are you there?
Hi, I'm sorry, I couldn't get it unmuted. This is really for Tracy, and it has to do with voter registration. I have been doing voter registration as a volunteer ever since I retired from teaching, and have always done it voluntarily. And in the past, I didn't do it during the pandemic, obviously, but in the past, I just called the Secretary of State's office and said, I need 200 voter registration cards, and they would be mailed to my home. Or I would go over to the Board of Elections in Northwest Plaza and ask for them, and they'd say, how many do you want? And they'd give them to me. This time, when I called Jay Ashcroft's office in February, so that would be before this recent Thursday law was changed, they told me they could not mail me any voter registration cards without me filling out forms. And so I said, well, then email me the forms, which they did. And one of the forms I had to sign and state that I was not going to be paid to do voter registration. I don't know where that came from, but to me, it sounded like voter suppression tactic. Also, when I went to the office in Northwest Plaza, the Board of Elections, and asked for voter registration cards, they said, we can only give you 25 at a time, and you have to sign this form stating that we gave you 25. This was all new to me, and to me, it really sounds like the GOP wants to eliminate being able to register voters.
Yeah, I mean, you're absolutely right. It's in this bill, and it's interesting to me that Ashcroft that his office would have said that in the winter, because I don't think we had anything on the books regarding it yet. But there is language like that in this House Bill 1878 that is headed to the governor. There was identical language in another bill, House Bill 1065. They're making it much harder for people like you, Lois, or people like the League of Women Voters to do work in the community to get people registered. So now, if the governor signs this bill, it says that any person who solicits more than 10 voter registration applications is required to register with the Secretary of State every election cycle. And then it also prohibits any person from being paid or otherwise compensated just for registering voters. So, you know, it seems to me like there are some folks out there that are fearful of people registering to vote even. But no, you're right. This bill it has a lot of things to it. It's definitely an omnibus elections bill.
Thank you.
I would just say, Lois, please save that paper, and I would or whatever communications you got, and Denise Lieberman. Do people know Denise Lieberman? Yes. Yep. Voter protection advocate. Get that info. It looks like Harvey knows Denise and Sydney too, because laws that were passed don't go into effect till the end of August. So we will get through our primary without this, right, Tracy? Without this law being in effect. So everybody just don't listen to what Jay Ashcroft says. He's not playing for real.
Good advice in general, right?
In the league, everybody, you should do you. But through the primary, 100%, please, and stop, and please help spread the word. They cannot mess us up for the primary. Now, once the end of August, what is the 26th or 28th?
28th, yeah. Most bills, if they're signed by the governor, go into effect August 28th.
Thank you, Tracy. And there's some stuff in here that I've heard the administration may not like. So let's just not stay the course. Do your good, excellent work and document this roadblock, please, Lois, and anybody others. Send it to Denise Lieberman, or it sounds like Harvey and Sydney are willing to take it so we can collect evidence. So, because we still have our friggin' right to vote for a while.
And I still made it to 3 high schools that I am familiar with and registered the seniors to vote.
Yay. Yay, good job. Okay, Dave and Dale, I believe you had a question?
Yeah, I think that that bill also allows unrestricted absentee voting, that is without excuses. But I don't know the details, and I also don't know whether that applies to the primary, since the primary is before August 28th.
Yeah, I don't think there was an emergency clause on that bill, on that part of the bill, so it won't go into effect before. Part of the Senate Democrats' compromise on that bill this past week was that the 2 weeks, so assuming the bill gets signed and it goes into effect, there would be no excuses absentee for the 2 weeks before the election. Right now, I mean, we can go and vote absentee, but you have to, check a box with your excuse. So the Senate Dems negotiated no excuse absentee for 2 weeks before each election, but that won't be in effect for the primary. But if it does get signed, it would be in effect for the November 8th election.
Thank you.
I just dropped a link to bill information from the House website, and it says effective date is August 28th, or proposed effective date, rather.
Thank you. Are there any other questions? Anyone raising their hand, or just speak up in case we're not seeing you? In that case, I have a couple more questions. What does the Missouri current statutes, if the Supreme Court puts this into effect, what effect does that have on things like the, I'm not sure the technical name, but the abortion pill? Pardon me if that's a harsh thing to call it. But I know that's used for therapies, and that there are some pharmacists that already, I think, refuse to fill it.
Thanks, Harvey. That's a great question. And Dr. Weisbart had his hand up. So I'll answer this question, and then maybe you can see if Dr. Weisbart still wants to ask a question. So medication abortion, the actual medications that are used to induce a medication abortion are used for other things. And so what will happen once the Supreme Court, which we, really think they're going to do in the end of June or early July, they're going to say the right to privacy no longer exists in the Missouri Constitution the U.S. Constitution, and therefore there's no right to an abortion. And then Missouri law has a trigger that these three people can pull. I mentioned the governor, the attorney general, and the legislature, and there will be this crazy tussle with lots of dust and fireworks while they do that, but they'll pull that trigger. And so Missouri law will then say no abortion is legal in Missouri, or all abortion is illegal in Missouri unless necessary for a medical emergency. And so that will cover whatever method of abortion, which mostly there are medication versions, and then there's an in-clinic version, sometimes referred to as surgical abortion, but really it's not surgery. It's a vacuum aspiration situation that's different than cutting into a human body. And so that is what will go into effect. I will say currently, medication abortion is not available in Missouri because of that health department kooky interpretation that docs have to do this medically unnecessary, inappropriate, invasive exam of putting their hands into a vulva in order to give a patient a pill early in pregnancy. It's not necessary. And the docs in Missouri have not been willing to do it. They've been referring Missouri patients to other states where they don't have to go through that unnecessary exam in order to access an abortion through medication. Harvey, did I answer your question?
Yes.
Okay.
And Dr. Weisbart, you have a question?
No, that was the applause sign. It wasn't the question.
Oh, okay. I get confused. How can I be confused? We've been 2 years. I think I must be 10 years on Zoom.
The other thing I wanted to mention and have Nevi expand on is during the pandemic, a lot of us were fortunate enough, if we have healthcare, to be able to have healthcare via telemedicine or telehealth. My understanding is that the legislature put something in place that prohibits the use of telehealth for reproductive health care like abortion. Is that true, Mevi?
Yeah, we had a decade before put a prohibition on that. So the best medical practice, and I know there are doctors on here, so please jump in. says that you can prescribe, counsel, prescribe, and actually deliver medication abortion pills for an abortion through telehealth, but Missouri explicitly prohibits that. So that is not an option available in Missouri. It is available in Illinois. And if you have questions about other states, you can let me know. And I think Tracy can forward me your inquiries, or Harvey or Cindy.
Yeah, there's questions about doesn't HIPAA apply to the privacy, medical privacy in this case?
No, HIPAA is not a protection against prosecution, because what they're doing is changing a legal medical procedure to becoming an illegal medical procedure. So if the medical procedure, like the ground just changes under you, what used to be legal isn't legal, and therefore something you would have done that would have been protected as regular healthcare, which is our point. Like, the more you marginalize regular reproductive health care, the more it's vulnerable to what's about to happen, which is illegalization, or illegal. I'm not sure that's the right word, but anyway, that no, you're not protected. Those providers of that health care are putting their licenses and jail time on the line. And so that's what this is coming to. And I know there are lots of questions about, what about pregnant people, or people who are pregnant, who seek an abortion, and are they going to be criminalized or not? So Missouri law makes pretty clear that that's not the intent, but there is this whole body of law and prosecution and harassment across the country. And Wisconsin's been a leading state on this, and there have been cases in Missouri where local prosecutors have been pursuing criminal charges against women they suspect of ending pregnancies in what that local prosecution believes to be illegal ways. And I think we're only going to see that increase, even though the anti-reproductive health care, the anti-abortion movement says their goal is not to criminalize women. There's a lot of people in that movement that actually do want to criminalize women. And that's a thing we're going to need to be on the lookout for and protect, and maybe raise some funds to defend people who end up in that situation. And more importantly, like, let our communities know that these are the consequences. And I guess 8:04, I don't want to take up too much more time, but I do want to say that the ultimate goal here is, and I think especially for many people on this call, I know have been advocating for this issue for many, many years. And some people say, like, why are we still fighting this? And I will say, partly it's because we're so darn effective. When people have control over their reproductive health and lives, they are much, and voting capacity, and I see the Ferdman crew with a question. When everybody has that control, society benefits, in my opinion. And people who have that control, we make changes. We affect elections. We affect our community. We get educated. We change the world. The changes that the people who have control over their reproductive lives can enact in our society are dangerous to conservative, white, super wealthy people. And that's why they're going to keep coming at us. And so for people who feel like, I'm tired of fighting this, I feel like, don't get tired. Like, when they're coming at us, it's because we're effective, and they know that this is the place they go to put us on our knees. And you know what? I don't think this call, we're not going on our knees. We're on the offensive. We're getting kicked out of the Constitution. We're going to figure out how to get ourselves back in the Constitution. And I'm sorry. Okay. Harvey, back.
Okay, question from Stanley Ferdman.
I have two questions. Number one, my understanding was many women get the abortion, the morning after pill, from out of the country. And they get it from Canada, etc. So I wondered a little bit, what are they going to go into your mail and check all that? And then the second part of the question is something that is not occurring to me. Oh yes, what about court challenges to this kind of invasion of privacy? Have there been any? Is there any thought about that? Those are the two issues.
So much. So let me just clarify one. Medicine has, and I'm sorry, I think Dr. Weisberg had to go, but there might be other medical professionals on here. And Tracy worked in the pharmaceutical industry. So you use pills for all sorts of things. So pills that prevent pregnancy are called contraception and birth control, and they're not impacted by Missouri's trigger law. Missouri's trigger law says if the medication or action or whatever is the intent to cause an abortion or terminate a pregnancy, that's what is banned. So be clear. I know former Senator McCaskill had sort of a confusing tweet thread on this. We think the end goal is they want to come after it all, but what will happen specifically with Missouri's trigger ban is about abortion and medication or surgical intervention to stop a pregnancy that's established. That is not Plan B. That is not birth control. So I just want to be clear about that. And then in terms of court challenges or cases, legal people are pursuing whatever legal things they can, and different states are approaching things differently. But when you look at that draft leaked opinion, the highest court of the land, we've lost. We have lost, and we cannot rely on them for this at all. And so all sorts of avenues to protect this right are being explored. And I'll just be honest with you, I've been in this fight for generations with Roe and watched it get eroded and eroded. And my interest with I'm 53. What I've got left to work with the young people leading this movement is, let's think about a more durable approach, a more equitable approach. And a lot of things are on the table, including, is it a Missouri constitutional? Is it a US constitutional? Is it both? And these are the conversations that are being had in terms of what we need to do. And what I would say to this group is the only path to a solution here is for all of us to sign up to do every single thing we can to show we're opposed to what is going on at the Supreme Court right now. We don't agree with that, and we do agree. And there's so many steps you can take. You can get involved. You're already involved. Local elections, run for everything you possibly can. Like, all the people on this call know that, we just really need to fill the ranks with people who are super committed to establishing and keeping this right in a more durable way. And I see more hands, so I'm stopping.
Yes. Alan, you had a question?
Sure. Yeah. And actually, I think you hit on a lot of it there. I was going to ask for some more specifics about what's next, and then you kind of went right into it. Right. So, but just to clarify, we're probably looking at legislation that's one of the things that's going to, that's the main path forward, whether it's state or whether it's federal. It's not that the Supreme Court is going to turn around and say, we'll take this other case and we'll give you back some of this right that we took away, right? and legislation is passed by legislators. And I know we all know this, but it's about getting more people like Representative McCreary into office, right? And so then it becomes campaign volunteer and donation and then running for things like you said. So yeah, I don't want to repeat all that you said. I'm just, yeah, thank you for going into that.
And thank you for that. And one more thing I would say is we've got some elected officials in office, right? There's the Biden-Harris administration. And there's a thing that they can do that we need to tell them to do that will help right now with Missourians who need access more than ever to birth control, to preventive care, to annual visits. The Missouri legislature, Tracy can talk more about this, like tried to keep Planned Parenthood patients from getting Medicaid care at Planned Parenthood. And we're going to try and keep caring for them, but it's not sustainable. And we drop out of the provider network, so our people don't know that they can come to us because of the state action. We're suing. We think we're gonna win, but the Biden administration could come down on Missouri and say, you are in violation of federal Medicaid law. You're gonna lose Medicaid if you don't give these patients access to care and put Planned Parenthood back in the provider network. They could do that right now. Sorry.
Yeah.
Anyway, so I'm saying that's a thing you could do right now. I've put our link in a couple times. I'll put it in again. You can find this like petition to Biden, like act now. We need to do this now. I see some more hands up. I'll stop talking.
Okay, I think Dave and Dale, you still have a question?
Yeah, I think that our legislature would be thrilled if we took away, if the government took away Medicaid money. That's what they wanted to do. They want to get rid of it also. But to clarify Rochelle's question about court challenges, the Supreme Court, if they rule against Roe, throws it back to the states. So we still have battles within the state, and things like crossing state lines. Those things could clearly be challenged in court as long as receiving medication by mail. Those could be challenged by lawsuits against the state. And of course, the ultimate resolution would be more legislators in Missouri that know what they're doing and not these nuts. And also more senators at the federal level, so that you only need 2 or 3 more Democrats at the national level that can fix this. That's all it would take.
Thank you. I agree. I also threw my name in. I raised my hand. I have another question. I'm wondering, I'm under the impression that in vitro fertilization would also be thrown back to the states, and in many states, and I'm not sure how Missouri would work. Would it be illegal in Missouri? And do you have any feeling for how the religious right may be, or I mean, there's a lot of Republicans that use in vitro. Is that a rallying point, maybe, that they might join in getting some of these rights back?
Great question, Harvey. And again, I think definitely former Senator McCaskill raised this question in a little bit of a confusing way that I want to sort out. So the Missouri law that will be triggered by the overturn of Roe from the Supreme Court is very clear. The definition, Missouri has tons of definitions of abortion that are not clear in our code, but the code that's connected to the trigger law is clear that you have to have the intent to abort or to terminate a pregnancy. So IVF, I don't think, and my lawyers don't think, are impacted by the Missouri trigger law. Are there other areas of Missouri law or future Missouri law? Certainly many proposals could go there. That's an intent of the Missouri legislature. I just want people to know, I play this role. I'm an advocate, but I work also for an entity that provides health care. And so I have to make sure patients need to know the facts about what services they can actually access. And so with that hat on, I'm saying I don't think the minute Roe is overturned, they lose their access to assisted reproductive technologies. Is it on the agenda of the people who have led us here? Yes. Will it happen immediately? I don't think so. People who are planning their families, planning their pregnancies, should pay close attention to this, and they're great advocacy organizations, but I don't want to scare people out of planning their families in this way, if that makes any sense. And then, so that's what I would say to that question. It's not an automatic thing that I think would happen, but I mean, I get our Attorney General is sort of happy and could do different things, but I think they have liabilities associated with that, and I don't know that that's where they're going to go immediately. So I guess my main message is people who are planning your family through IVF, consult with whomever you're working with related to that, but please don't get overly scared in planning your family. Reach out, find out your options, and we shouldn't be scaring that community out of planning their families and proceeding with planning their families, because we have a lot of great centers that are very advanced at helping people with assisted reproductive technology, and that's not on the automatic chopping block like the Planned Parenthood facilities that provide abortion in Missouri, albeit to a very few people right now. Most people are going out of state. That's the thing that will be immediately impacted. Harvey, did I cover that appropriately?
Yes, you did. Thank you. So I want to thank you for taking the time, and we've kind of kept you a little over time.
I maybe have kept you over time, but
no, that's fine. And in fact, if people have more questions, that's fine. But for those who want to leave, I do want to ask you, in addition to working to get the right legislators put in place, are there any advocacy groups or funds that people can donate to specifically, maybe to assist for people that will need to go out of state while this all gets sorted out? It takes a while to get the right politicians in office, and even once they're in, it's going to take a while to get a momentum to fix a lot of this, I would think. So in the meantime, what recommendations do you have?
Well, there's a group that I support. I think it's called the Missouri Abortion Fund, and it's a coalition of groups, including Planned Parenthood and Hope Clinic, working together to help Missourians who need access. And it is just for Missourians, even if it's a Missourian that has to go to Colorado or something like that. So I do financially support that organization to help folks, especially those that are struggling with access and that kind of thing. We all can complain about gas prices and things like that, but there are folks that are really, really struggling out there, and they also deserve to have access to their full range of care. So I will see if I can find a link to.
Is that mofund.org?
Yep,
you just got muted.
I put it in. Yeah. Tracy, you're muted.
Okay, mofund.org.
Yeah, and maybe that is the group that's coordinated with the different clinics too. One of the reasons I like that as a community advocate is you don't have to pick your favorite organization. This is money that is being used in a team sort of way.
We also heard about Access Missouri. Do you know anything about that?
That is Dana Sandweiss's. She's associated with that group. I I think are they a political action committee? I think. I'm not sure that they do.
They are also trying to seek funds to support transportation and able to get people. Yes. I mean, we were just at a presentation a few nights ago, and Access Missouri that is what their ultimate goal is, to be able to provide transportation. So I don't know what you know about it, but.
Well, I know people associated with that organization who I respect greatly, so I'm glad to hear that they're helping with that.
Yeah, thanks, Tracy. I would say, yeah, the Missouri Abortion Funds, and I see Katie Greenstein also put in a link. So the Missouri, it's in the chat. I don't know, Harvey, if you circulate links that are in the chat, or I'd be glad to help with that. But Missouri Abortion Fund does help Missourians fund, and that is a call to action. We're asking people to support, because we estimate that in this region there will be 14,000 more people needing services in Illinois, and not just needing abortion services, but needing all the wraparound travel, childcare, other services that are associated with the regional logistics center that Planned Parenthood and Hope Clinic in Illinois have formed together. So everything I've linked to so far includes the Planned Parenthood advocates, but I've also put the Missouri Abortion Fund in there. Pro-Choice Missouri is also an advocacy and a service organization. They operate the Clinic Escort, which helps get patients safely to the health centers in Illinois, especially. Planned Parenthood, we also have a patient advocacy program. Like I said, I see Katie has put in like the National Abortion Fund piece. And so those are all definitely great uses of your resource advocacy and support as people we're just going to be in incredible need. Like I think people on this call know, but I'll just say that once Texas fully banned abortion prior to 6 weeks, all of the states around Texas were impacted. So Oklahoma's schedule filled with Texas people, and all of a sudden Oklahomans were having to go to Kansas, and in some cases Missouri, and in some cases Illinois, and then the patients from those states were having like, oh wait, the schedule is full. And as we know, pregnancy care, termination, any kind of pregnancy care, time sensitive, all those people were having to go in other places. We're also advocating that the federal administration, and of course Illinois, any of these states that are surrounded by these states, up their financial investment in the family planning and abortion access systems in their state, so that their own citizens or the residents of Illinois aren't getting cut off, and that they can accommodate the influx. Sorry, Harvey, I see your hand up.
Harvey, you're still muted on you're on the other side.
Thank you very much. With all these efforts to force women to have pregnancies that they may not want to carry through, I'd like to take a moment and go back to the origin of those pregnancies and ask if any of these laws anywhere are stiffening up the participation of men in raising these children.
I have seen no indication of that. This is just putting it all on the pregnant person. So I've seen no mention of equal responsibility. So, and I guess the other thing that's so disheartening to this is, like, a lot of us on this call, we live really close to Illinois. So if somebody in our circle here in our region has an unplanned pregnancy and they need to have an abortion, they can go to Illinois, and it's fairly easily. But I think you all care about other people that live, I mean, you could live in a part of Missouri that is 6 hours from Illinois. And I think that's really unfair to people that, depending on what zip code you happen to live in, that you have an access to a different range of healthcare. And so those are the things that keep people like us up at night. I feel fortunate that my constituents live close to Illinois, but I care about all Missourians. And so what we have to try to figure out is how we are going to have a more equitable type of healthcare for all people.
Tracy, thank you. In light of that last question, gosh, I lost my train of thought. Oh, I know. Is it possible to make an argument that if the states don't increase the aid to raise these children, that in effect these become unfunded mandates?
Wow, I mean,
how's that for a thought?
That's mind blowing. But I mean, yeah, I'm sure somebody could make that argument very coherently. Missouri already underfunds public education. We don't provide medical care for women more than 60 days after they give birth, which is why Missouri has a very, very high rate of maternal mortality. We're right up there with maternal mortality like third world countries. And we refuse to acknowledge that or do anything about it. So, we are creating a situation where we're going to have a lot of folks that truly aren't having their basic needs taken care of. And that also should be a call to action.
Yeah, one other thing I'd like to mention.
And Harvey, can I just jump in there? That is true. That piece of information you introduced, that the impact of the decision. But if we don't locate the conversation about centralizing the people who can get pregnant and their ability to live their fullest lives, if we're locating that somewhere else, like that's partly how we got here. That's how Roe became so endurable, is because it didn't center the fact that ultimately the people who can get pregnant need to make this decision. It had to do with this like kind of convoluted time period that then changed, and then people were able to poke at it and medical thing. Like ultimately building a durable, equitable, accessible right to live our fullest lives. If you can get pregnant, if you are connected to a person to get pregnant, if you are in a family where people can get pregnant, needs to rest with that family. That's the right that we have the opportunity to strive for now. And I really, really want the people on this call who I respect and adore to think about. That's the right. And we can't get distracted from that by like, oh, pollsters say we can go this far or that far or whatever. Like, let's just stay right centered there.
Understood. I think we have a hand raised. Dave and Dale, did you want to?
I just wanted to comment on your unfunded mandate. The state is full of unfunded mandates. They do it all the time. Just in education, every time they require schools to teach this or that or the other subject, that's an unfunded mandate because people have to be hired to do it. And also, every time they impose more rules on election boards, those are unfunded mandates too if they require more resources that are not provided by the state. So they do that all the time, and there's nothing that presumably that can be done about it.
Thank you. Are there any other questions?
This may be a bit naive. This is my first election cycle with the group, but my question is, who's ready to get to work? Like, we've been talking for an hour and a half. Like, what are we gonna do, y'all? And like I say that, like, I want to get something going, but I'm probably not the best lead abortion spokesperson. I'm a great like second, third level, but it affects me less. Although I actually have, well, never mind. I won't go into that. It's late. But candidates, when are we knocking doors? Everybody else, who do you want to knock doors for? What are we gonna do, right?
Well, we're hearing from Katie. Knocking doors in the 101.
Cool. And 101 does overlap with Maryland Heights just a little bit. So you're one of ours.
Yep.
Okay, Tracy's going early June. Nice. Sorry, Representative McCreary.
And Trish did hop off, but she is canvassing every weekend. Every weekend she's on the doors. So and you can be out there too.
I'd like to let anyone who wants to come join me at doing voter registration this summer. I typically go to, well, the schools are closed now. I'll be going back to the schools in September, but I go to places like the Overland Farmers Market, the Kirkwood Green Tree Festival, set up my little table with my chair and get voters registered. I typically look for places that I feel comfortable, if you know what I mean. And if anybody has a suggestion for where would be a good place to do voter registration, please let me know. Also, I phone bank with Pro-Choice Missouri once a month or more frequently. And you're welcome to join Pro-Choice Missouri and help us. We do the phone banking through a Zoom call.
Thank you. And what I put on the screen is not an endorsement. These are the 4 people that are here tonight. There are other Democratic candidates for some of these seats. Melissa, I think you are unopposed in the primary, if I remember right.
I am unopposed, correct, yes.
And Tracy, I think you're also unopposed in the primary. Is that correct? I think we lost.
Yeah, I don't have a Democratic challenger.
Excellent. Okay.
I have
there you have it.
I have a question. You know, it was interesting to me, this whole meeting. I thought it was very helpful. But one of the questions I have is, you know, that there are Republicans who also need and want abortions. We all know that, correct? They're not left out in the need column. So the question is, we need to have a small group of people talk about what ways may we look at in getting and finding and recruiting Republicans to be part of this. Now, whether we need to wait until after the final law is thrown, or whether it's something that we need to have discussions about before that final law in June. I think that we're going to need help, and those people who need help, whether they're Republican or they're Democrat. I don't know how to do it, but I think that this is something that a group of people, small group as it may be, because you don't want to waste a lot of time. Question is, are there ways in which we can recruit Republicans to help deal with this issue that we feel many Democrats need? That's the only question I have.
Well, I think you're exactly right, Stanley. And I remember when I first started volunteering with NARAL, we used to endorse pro-choice Republicans. I've door knocked for pro-choice Republicans. So just because there aren't people that talk about being pro-choice Republicans that are in elected office in Missouri, that doesn't mean that our neighbors who are Republicans aren't pro-choice. And so, I think tonight our conversation was focused more towards Democrats because we're part of a Democratic club meeting tonight. But yeah, you're absolutely right. When we're talking about this in our community with our circles of friends, family, that kind of thing, this is definitely not a partisan issue. This affects all people.
Right. Okay.
But the solution is to vote Democrat, even for your Republican friends.
We might be able to recruit by helping people get their needs met. That's part of life, recruiting.
I agree. And I also just want to say, I don't like what's going on in this country right now, and what happened in Buffalo this weekend means we all have to do everything we possibly can to get together and create a durable, equitable solution to what our country needs. And I think the people on this call really understand that, and we can't be disorganized about that. We need to stay organized about that it's all of our rights bound up together, and there are actively people trying to disorganize us and separate us, and can't let that happen. The people of Buffalo, the survivors, the victims, we owe it to them to do this work. Thank you for having me here. I'm really appreciative to be here.
The many can defeat the money when we organize.
Harvey, you're muted.
Sorry. Any other questions, comments?
I just want to point out that pro-choice people outnumber the anti-choicers, and Democrats outnumber Republicans, even in Missouri. We just have to make sure we all get out and vote.
That is a fantastic statement to close the meeting on. I agree. Tracy and Maeve, do you guys want to make a final closing statement, or do you think we're there? I think we're there. Okay. Well, thank you, Lois. That was perfect. Thank you, everyone. Stay tuned. You'll get emails for our next meeting. If you know anyone you want to have added to our email list, please forward them on. And of course, you're always welcome to forward our emails out to others. With that, Sydney, any closing comments?
I do have two announcements. I just want to lift up what Dennis put in the chat earlier, that the St. Louis County Democratic Party is looking to hire a new executive director. So if you are interested in that position or know anyone that is, please pass along that information. I think that, this is a really beneficial position for our county, and hopefully that we can get some great support out here for our Democratic candidates. I'm just going to bump that link to the job posting again in the chat. And then the other announcement is that we have the gala for the St. Louis County Democrats is going to be held on, I believe it's July 16th. Yes, at Leuna Event Center. And so The early bird deadline for tickets is June 16th. I'm gonna also drop the link here to where you can purchase tickets if you'd like. But we may also be trying to put together a table for any Creve Coeur Township members that would like to sit at a table with us. But we'll try to get that organized before June 16th so that we can get in on that early bird deadline. And that's it.
Thank you. Okay. With that, I'll close the meeting. We're not
question?
really... Yeah.
Question. Hi. Can you tell me how many participants were in this meeting?
Yeah, the high point was about 37 or 39. I try to glance at it every now and then. And then once we crossed 8 o'clock, people started to leave slowly.
I think people will mobilize after as soon as we get more initiative. I think there'll be more mobilization going on. I think there'll be more events. I think that'll be good.
Yeah, I think that, you know, this is, I like, you've probably heard of Cylindra Lake. She's one of the preeminent Democratic pollsters. She said the Republicans have done for our party what we couldn't do for ourselves, and that's motivate the fringe Democrats to come out and vote. So that's really important. The other thing that's just an interesting sidebar, I don't know how many of you heard of the show Freakonomics, but they did a study. I think it's on NPR. It's around if you look it up. These are real economists that do real studies. They did a study on crime rates and the passage of Roe versus Wade, and they found that there was a correlation between reducing unwanted births and reducing the crime rate.
Oh, yeah.
So I thought that was real, you know, I mean, it's like, duh, but that they actually documented it. So.
Well, I know there was a lot of talk about if women can't have abortion, how their economic factors are going to all change. They're not going to be able to go for education. They're not going to be able to find childcare. I mean, it's a domino effect.
It's repressive. It's really bad.
Yeah. Right.
Yep. Okay. Thank you, everybody. See you next month.